So we found out April 24th that we were pregnant with what we thought were twins, and they were unsure what it really was. So they said it could be a subchorionic hemorrhage or it could be something else. So they said we need to refer you on to a perinatologist, and we came and visited Dr. Fleming. We were trying for over a year and a half to get pregnant, so when we first found out, it was pretty devastating because I'm a nurse and I do kind of know what a molar pregnancy means. I've never heard of it with another fetus. So to me, it was just like, it's going to be a long road that we have to go down.
Rachel and Kyle's case was unusual because not only was it a molar pregnancy, but it was a twin pregnancy with not only a mole, but a normal intrauterine pregnancy associated with it, which really added to the risk. Normally, with a molar pregnancy, the plan is to evacuate the uterus as soon as possible.
We had a follow-up here every week. There was a lot of complications with bleeding, and our goal was take week by week and just hope and pray that he would come out just fine.
Just uncertainty because it was so rare. There wasn't a lot of answers, so we just kind of trusted the doctors and they were comfortable, and at that time we would feel at ease.
And every time I would see Dr. Fleming, I would have ultrasounds constantly. They would do measurements on him, check his status, and as soon as we kind of seen the ultrasound and see him moving around and knowing that he was growing appropriately, it made us feel a little bit more at ease that everything was going to be okay.
It's fairly uncommon, and it's very, very rare to have a twin situation where one is a molar pregnancy and one is a normal developing twin.
So the week before I had him, I was having a lot of complications. So never having a C-section before, it was kind of stressful in that fact, and knowing that he was only 32 weeks along, I was like, okay, is my baby going to come out okay? But going into the whole situation, they all reassured me very well. Everybody was very prepared. Anesthesiologists were explaining everything. Dr. Schneider, just like everybody was great as far as explaining what was going on at every single second. And he came out and the NICU staff was ready for him, and just knowing that he was breathing and stuff on his own just was like a relief off of me.
Her case obviously was a big success. We didn't get to full term, but as I said, 32 weeks is a home run compared to some of the other cases. That's why I do what I do. It's very rewarding.
Hopefully by us sharing our story will help somebody feel a little bit more ease about the situation and knowing that miracles can happen. I want to thank Dr. Fleming a lot because throughout the whole process he was always positive, just reassuring us every single step of the way, and that really helped me keep calm throughout the whole process that everything's going to be okay.